Hi everyone, this is Nerdy Girl Alex, and I'm here to answer a question that we commonly get asked, or at least I do in my practice, which is, doesn't getting an IUD really hurt? The answer is yes, maybe, but most people end up not minding or feeling that it was totally worth it. So first of all, let's talk about what IUDs are and how they get inserted and what types of symptoms you might be able to expect. So first of all, an IUD is a small plastic T-shaped device that gets inserted into the uterus and either uses a small amount of hormone like a progestin or copper to prevent a pregnancy from occurring. So these little devices then sit inside of the uterus. Now the uterus is generally smaller than your fist, so it's a relatively small organ in a non-pregnant person. And we have to get it up inside the uterus, which is not something that typically happens. Usually only microscopic sperm swim up inside the uterus. So let's take a look at a pelvis. This is a model of a pelvis. And so it's as if the person is laying down on their back, head this way, legs this way. So this is their belly would be up here and their back is down here. So what we can see is the pubic bone right here. That's that hard part that you feel right down. And then the urinary bladder, that's where your urine gets stored until it's time to go pee. And then we have the uterus behind that with the fallopian tubes coming off to the side with the ovaries. And then behind that we see the rectum and of course the anus. So the tube that leads to the uterus is the vagina, of course. And so, right, that's going to go right to the opening of the uterus, which if we turn this model this way and we look inside the vagina, I think you can see the opening of the cervix there, or of the uterus, which is called the cervix. Okay, so that cervix is like a little fat little mini donut that's so fat that there's hardly any hole in it. So that's what the cervix generally looks like. This model is not useful in showing us what the vagina normally looks like because the vagina is kind of like a sock. If there's nothing in it, it's typically closed. So if you go to get an IUD placed, what the provider is going to need to do, your clinician is going to use a device called a speculum. You've maybe seen this before if you've had a pelvic exam or a pap smear. And what this does is allows us to open up the vagina, open up that sock so that we can actually see the cervix at the end of it. So this will be inserted into the vagina, this is a smooth object. It is smaller than a penis. It usually feels weird and uncomfortable, but it should not be painful. And then they're going to open it like this so that they can see that cervix at the end, because then they're going to have to go up through the cervix to get into the uterus. So in order to do that safely and effectively, a lot of providers will then, once they can see the cervix, use a little device, kind of like tweezers, to grab a hold of the cervix and stabilize it and hold on to it so that they can make sure they know exactly where everything is and keep it stabilized during the procedure. To put in the IUD then, they're going to use a straw-shaped tube like this to actually insert the IUD. This one has an IUD already preloaded inside of it. I'm going to show you how it works. So if this is the uterus, about the same size as your fist in a non-pregnant person, slightly smaller. So it's going to go in through the vagina and then in through that cervix. Now, grabbing onto the cervix with the tweezers and then inserting this insertion device, this little straw through the cervix, can absolutely be uncomfortable, which is doctor speak for painful. So you can expect to feel a big cramp. Now, some people will feel this pretty intensely, some people will not. It varies a lot from person to person. If you have been recently pregnant or recently given birth vaginally through this cervix, this procedure tends to be easier and less painful. If you've never given birth before, we would call that being a nulliparous person, someone who's never given birth. Your cervix tends to be a little bit tighter, and this procedure tends to be more uncomfortable. But again, it varies from person to person. Very occasionally, that cervix is so tight that it's like, ye shall not pass, and we actually cannot get the insertion straw through and into the uterus. But most of the time it works fine, but you can expect to feel a big cramp and for it to feel very strange. We're not used to things going up into the uterus. Once the straw goes inside the uterus, your clinician will check. I don't know if you can see here, there's little centimeter markings to make sure that the inside of the uterus is big enough to hold the IUD. Sometimes they'll measure that with a separate device ahead of time. And then they'll go ahead and release the IUD into the uterus. Now, this particular demonstration IUD is a little bit difficult to see against this little model, so I've got a different one for you so you can see that. This one happens to be a copper IUD. You can see it's white plastic with copper wire wound around it. And then I've got some little strings that hang out the end. So those strings will be left there. They hang into the vagina. We'll usually cut them at about 2 centimeters so that when the day comes that you want to get this removed, it's really easy actually. We just pull it out and then you're done. So let's talk about symptoms with insertion. So you're getting a pelvic exam, speculum is inserted, feels uncomfortable, feels weird, usually should not be painful. Placing the tweezers on the cervix can feel like a big cramp. Inserting the straw through the cervix into the uterus, definitely big cramp and weird. Placing the IUD inside the uterus, again, sometimes people feel cramping and general weirdness with that. Everybody's body is different in terms of how it responds to these types of sensations. Some people will get what's called a vagal reaction, where they'll start to feel nauseated or flushed, hot, sweaty, pale, sick to their stomach. Some people will even vomit, or very occasionally people can actually pass out from this type of discomfort, much like people can pass out with seeing blood or getting a flu vaccine or all different types of things. Our bodies don't always behave the way we would like them to. After the procedure, therefore, it's recommended that if you're having a lot of symptoms, you rest and stay flat for a period of time until your body has recovered. I'll often offer patients to have some juice or some cookies, crackers, kind of like after you donate blood, and just relax and sit for a while, and then gradually move to a seated position and make sure that everything's feeling okay. I also recommend that people plan that for the rest of the day, they can take things easy if needed. So it's a great time to just sit on the couch, watch your favorite movies, eat bonbons, and take some ibuprofen or acetaminophen as needed for cramping and discomfort. After that first day, most people feel a lot better, and any cramping or discomfort that they'll feel tends to go away over the next several days, if not before then. So again, with insertion, expect to feel a big cramp and perhaps some real ickiness, depending on how sensitive your body is to those types of things. And then afterwards, some cramping, kind of like a period for several days to a week or so after. Most people's bodies then respond really well to the IUD. And in a survey that I did with a colleague of mine at Cornell University years ago, we found that 80% of people highly recommended this method to a friend, despite having significant discomfort with insertion. So the end answer is yes, getting an IUD placed can be uncomfortable or even painful, but the vast majority of people who get them find that it was absolutely worth it. So see the link below for the data from that study, and I hope you found this helpful. Let us know.